Hi, this is Divya Prakash. This video is continuation of Management of Radiation Emergencies of Nuclear Medicine Part 1. So please watch that video first. The link is given in the description. In last video, we discussed definition of radiation emergencies, types, articles required, principles of handling radiation emergencies, and preventive measures. We discussed two conditions from various types. In this video, we will discuss rest of the conditions, their management, and personal decontamination as well as surface decontamination. So let's begin and discuss personal decontamination and start with the external one. Survey body from head to toe with survey meter, and if any contamination found, we need to decontaminate that area. For decontamination, start it from periphery to the center of the contaminated area. Please note that early hand washing is very important. The exposed intact skin should be showered or washed with regular warm water. Since most radiological material is located on head and hands, hot and cold water should be avoided, as hot water enhances the absorption of radioactive material due to increased skin blood flow, and cold water closes the skin pores and allow trapping of contamination inside. The patient should be in head back position during initial showering. The procedure should begin with soap or shampoo and water. The radioactive substances usually rest on the thin film of the oil that covers the outer layer of the skin. Ideally, all contamination should be removed and care must be taken not to irritate the skin. If skin barrier is lost, some radionuclides could be absorbed directly through skin, so we should be careful. Hair should not be shaved since shaving may increase absorption, and at this stage conduct a head to toe survey, and if contamination persists, repeat the procedure. In general, no more than 2 or 3 cycles should be attempted. In case of a small area of fixed contamination, it could be covered with adhesive plaster and left for a day. The residual contamination will come off when the plaster is removed. Chemical techniques are rarely needed. 0.5% hypochlorite solution can be used as a chemical technique, and it will remove radiological contaminations. Commercially available decontamination agents appear to have offered very little over soap and water for cleaning the contaminated skin for short-lived radionuclides. In general, gentle washing with soap and water will remove 95 to 99% of radionuclides present on intact skin. All contaminated material, clothing, linen, swab, etc. should be placed in large impervious plastic bags, sealed and labeled appropriately. Let's see the management of internal decontamination. It occurs when a radioactive material is breathed in, swallowed, enters the body through an open wound, or is absorbed through the skin. It crosses the capillary membrane through passive or active diffusion mechanism. Treatment begins when the patient is medically stable and external decontamination is complete. Rapid intervention is critical, else it will be very difficult to remove that. It can be determined by positive nasal or oral swabs through bioassay, monitoring of feces, urine, and possibly by the blood. Once you come to know that there is internal contamination, immediately remove contaminants from the mouth, GI tract or respiratory tract by inducing vomiting. Seek medical supervision if needed. Accelerate excretion of contaminant by washing open wounds. Patients exposed to radioactive iodine to be treated with supersaturated potassium iodide. The dose is, for adults, it is 300 mg per day by mouth for 1 to 2 weeks. It is contraindicated in the case of iodine allergies. There is a disclaimer: I am not a doctor. For treatment and doses, please consult a doctor. Calcium gluconate or calcium chloride can be used in case of strontium or radioactive calcium contamination. The dose is 1 gram of calcium chloride or 3 grams of calcium gluconate intravenously. We have taken a little extra time on internal and external decontaminations because it is a very important thing to know being as RSO. Now we will discuss about surface decontamination. In case of short-lived contaminations, the material can be isolated and stored for decay of contaminant. Decontamination of surfaces should preferably be attempted by wet method, that is, by using soap and water and brush. This can be repeated as required. Glass surface can be decontaminated using chromic acid or trisodium phosphate. Metal surfaces can be decontaminated using solvents such as inorganic acids, acid mixtures, maybe dilute nitric acid or 10% solution of sodium nitrate. In case of serious contaminations where contamination is well fixed, entry into this area should be strictly forbidden until the radiation level reduces to below the permissible limit. Let's discuss incidental release of radioactive dust, mist, fume and gases. As like spills, it is also classified as minor release and major release. If the amount of released radioactivity does not exceed 100 microcurie and a restriction for access to the contaminated area does not exceed 24 hours, called as a minor release, and if it is more than this, it is called as a major release. The following procedures shall be followed in case of either minor or major release. Notify all personnel to vacate the room immediately. Shut down ventilation system if possible, unless it is determined that the room ventilation system needs to be used to clear the air for access purpose. Vacate the room. Seal the area if possible. Ensure that all access doors to the area are closed and posted with radiation warning signs. Survey all persons who could have possibly been contaminated and take appropriate action as necessitated. Decontaminate the area only when advised and supervised by the RSO. Allow no one to return to work in the area unless approved by the RSO. Once things are settled, determine cause and corrective actions needed. Document the incident. Notify to head of department, licensing and regulatory authority. In case of vomiting of radiopharmaceutical by the patient, it is to be treated same as spillage of radioactivity, and all the steps mentioned in the management of spills to be followed. Now the management in case of death of patient with administered activity in the body. The body should be released to the relatives only when the level of activity in the body is within the permissible limits for cremation, burial, post-mortem or embalming prescribed by regulatory body. The table shows maximum activities of radionuclides for disposal purposes without special precautions. The activities mentioned in the table is in the unit of megabecquerels, that is MBQ. In case of situation where immediate release of body is unavoidable, then the organ with accumulated activity be removed before release, and even after removal of vital organs, the limit should not exceed. The removed organ with radioactivity should be disposed of as per disposal rules. During cremation, specific safety precautions are to be followed and must be supervised by RSO. The designated RSO shall recommend methods on dose reduction to the personnel involved in washing, preparing and transporting the body to the burial ground. If an autopsy to be performed, the RSO should supervise the proceeding. During post-mortem or embalming, all contamination control measures should be adopted under supervision of RSO. Now let's discuss if there is a fire in a radiation facility. There are two types of fire. One is minor and the other one is major fire. The fire which you can extinguish with fire extinguishers, which are generally present in every department, is called as a minor, and if it is beyond control of those extinguishers, it is termed as a major fire. So as a first responder, immediately try to extinguish the fire, and that you should do only if there is no major fire hazard or radiation hazard is present. If this fails, follow procedure for the major fire. Notify all persons present to vacate the area, inform RSO and the fire department. Once RSO reaches, he see all the possibility of fire extinguishing, isolate the area to prevent the spread of possible contamination, survey all persons involved in combating the fire for possible contamination. If someone is found contaminated, decontaminate that person by removing contaminated clothing and flushing contaminated skin with lukewarm water and then washing with a mild soap. Allow no one to return to work unless the area is approved by RSO. Report incident, investigate root cause and determine future preventive measures. Now in case of major fire, notify all persons present to vacate the area and inform fire brigade immediately. Survey all involved persons for possible contamination, and if someone is found contaminated, decontaminate that person by using the method as said earlier. Allow no one to enter the area. Upon arrival of first responder, that is fire brigade personnel, here the person who see it first and the RSO, they are not the first responder. The first responder is fire brigade person. So inform them where radioactive material are stored and used with best possible entrance route to reach. Inform all precautions to avoid exposure or a risk of creating radioactive contamination by use of high pressure water, etc. Once fire is extinguished, determine a plan of decontamination of area. Allow no one to return to work unless the area is approved by RSO. Report incident, investigate cause and determine future preventive measures. Now in case of loss or theft of radioactive material, initiate immediate and exhaustive search for the material, and if needed, request for assistance from higher management. Promptly assess the situation. If loss or theft is confirmed, Inform police services and AERV. Document the incident and cooperate fully with police actions. Once the incident is eliminated, determine the cause, execute corrective actions, and assess steps to prevent a recurrence. Submit final incident report to regulatory body. In case of security threat or unauthorized entry to a radiation laboratory, as a precautionary measure, all the areas are to be marked clearly for strict authorized person only, and persons with proper training should only be allowed for unescorted access. As a first responder, initiate the following actions. Inform that the area is restricted for the purpose of radiation protection and escort out the person from the laboratory. Get the person's contact information and try to find out why the person attempted to access the laboratory. Report the incident to RSO promptly. Now RSO shall determine if the person has legitimate reason to access the laboratory. If prima facie confirms doubt on legitimacy of person, inform police and get the matter investigated. If person is found innocent, provide general outline about radiation safety and keep the record. Now in case of bomb threat, as a first responder, notify all persons in the area to stop the work and leave immediately. Notify RSO and police and briefly describe the nature of situation. Now RSO shall inform police about the storage of radioactive material with the best possible route as well as precautions to avoid exposure or risk of creating radioactive contamination. Here the first responders is police. They take charge and proceed as per their standard operating procedure. Once the incident is eliminated, perform thorough contamination survey and decontaminate if necessary. Determine cause and needed corrective actions. Document incident and notify a regulatory body. Now in case of natural disaster such as tornadoes, floods, explosions, earthquake or other major emergencies, RSO is not first responder again. The major function is assisting with facility specifications and guidance on radiation protection to first responders. As RSO, assess the situation and notify authorities as appropriately. Upon arrival of first responders, inform location and best possible route for radioactive material as well as any precautions to avoid exposure or risk of creating radioactive contamination. Allow no one to return to work unless the area is approved by RSO. Document incident and notify regulatory body. Now we'll see the procedure for reporting of emergency. All incidents which are mentioned earlier are to be documented and reported to regulatory body. In India, the regulatory body is AERB and it is reported through online portal called eLORA, that is e-licensing of radiation application system. The route is as follows: login, go to the regulatory forms, go to incident reporting and then incident intimation report. It has predefined field for misadministration, personal overexposure, theft of radioactive source, loss of radioactive source during transportation, minor spillage, major spillage, physical damage to the equipment, fire incident or accident, death of a patient with administered activity, receipt of damaged radioactive package, incident during transport of radioactive material, and there is a separate column as others where you can report any matter which you feel appropriate to be reported. Now the channel and timeline of reporting is as follows. RSO to report to employer and Radiation Safety Committee of institution with a copy to head Radiation Safety Division AERB as early as practically possible, that is within hours. Employer to report to incident to AERB within 24 hours of its occurrence. Lodge a written complaint with the police in case of loss or theft not traced within 24 hours, and RSO to carry out investigation and submit final report to AERB. Now the training and exercises. All RSOs should conduct regular training and mock drills on radiation safety to their personnel in handling radiological emergencies on a periodical intervals. Now some disclaimers. Please check all the information, latest rules, regulations from the appropriate authorities and correct me if found any discrepancies. Please feel free to write us at support@nuclearmedicinesolutions.in for any queries, feedback and topics of your choice to be addressed. Visit nuclearmedicinesolutions.in for further information.